We are getting started. The team is working hard. You can see the smaller the incision, the more stuff we need and the more people we need. Anyway, getting back to this case at hand. We have a young gentleman with pelvic dysesthesias and back pain. Due to this right here, that's a perfect disc, kakapupu disc. You can see it's flattened. It no longer has a central hydrated gelatinous core called the nucleus. It's all dried out like beef jerky. And right here, some of the disc squirted out the back, and there's a white spot there that's called the HIZ, high intensity zone, and it represents an annular tear that is inflamed. But here's the rub. Most annular tears are asymptomatic, which is not the same thing as saying all annular tears are asymptomatic. If you can figure out which ones are symptomatic and which ones are not, you can take care of these patients. And guess what? We did a targeted injection where we bathed this whole area with two medicines, an anesthetic and a steroid, and the patient got temporarily better, but unfortunately the symptoms came back. But the important thing about that is that that temporary improvement further reinforces our diagnosis. We're going to use the laser endoscopic spine surgery technique, reach inside this disc herniation and annular tear and remove all the nucleus pieces that are trapped in there. And then we treat the edges of the tear so it starts a new healing reaction, and we reach inside the disc and remove any loose pieces so we don't have a recurrent disc herniation. All followed by a little old band-aid and hopefully a very rapid recovery, so wish me luck. Okay, I've got the tiny little needle in. This is called the chromatodiscogram. I already see the tear. It's just above the needle. And this disc is, let's see, what word technically should I use? Kakapupu, maybe? Sticking my pinky out because that's how delicate this thing is. And there's the tear, look. It goes straight up right there. And look at that, it's like squirting out like a, I don't know, hot pimple or poop. Sorry, I couldn't help myself. Look at that tear, jeez, you poor thing. I don't know why I'm surprised, I saw that on the MRI, but it's sort of like when you go treasure hunting. You have a map, you know the treasure's there, but when you actually find the treasure, it's still awesome. That feels pretty good. There's something right there, though. Yep, right there. Oh my God, look at that. That is exactly where that white spot was on MRI. Right there. Oh, how cool is that? Surgery's all done. It went absolutely beautifully through that little poke hole. I found a bunch of bad-looking things that would explain his symptoms. And so I'm really expecting a great result, and we're all praying for a speedy recovery. So best wishes.